Hello, good morning. Now, excuse me. Good morning, everybody. So, how is things? How's life? Hope everybody is doing well. Hope you guys all had a good weekend. Whatever you did. Not that I care to watch any of it. The NFL draft was on. If you watched that, heard it had a big draw. Yeah, that's about as exciting as it gets around here. Right, built some cardboard forts today. Yeah, it was really enthralling stuff. But what we are going to be getting into today is we're going to be finishing up the urinary system. If you'll recall, right, last class we had gotten into and through talking about the renal corpuscle and the renal tubule. Right, the renal corpuscle, that was what actually produced, right, the filtrate. And then the entire process throughout the tubule, that's where we could then modify that filtrate. Right? Recall how the filtrate was produced here, and then it got shunted down into the tubule, and then along the tubule, that's where the body could either reabsorb the molecules, or further molecules could be secreted into, I don't know why I keep drawing those stupid arrows, there we go, or the body could secrete further molecules into the tubule, right? That's what we had gotten into, we had gotten through that last class. Right? Where we had kind of left off on was looking at renal disease or kidney disease, right? Just talking about issues that may impact the kidney itself, right? The last one we had touched on, we got through it, but I'll just kind of briefly mention it now, but was renal hypertension, right? Renal hypertension, again, that's when there is elevated blood pressure as a result of the kidneys, right? Remember how we had talked about last class, or perhaps 2 classes ago, mentioned how there's a huge amount of blood supply which goes into the kidneys, right? Remember the renal artery, right? As the renal artery enters into the kidney, there are multiple branches which arise to eventually give rise to the afferent arteriole, right? So if there's enough vasoconstriction, right, the idea, or kind of one of the theories as to why this develops, if there's enough vasoconstriction systemic wide, right, that's going to increase blood pressure. Or if you'll remember, one of the reasons why that happens is because of the release of renin. Right? Renin is a hormone which is released from the kidney, and that's released from the kidney. When renin is released, right, that eventually causes the release of aldosterone, which leads to the reabsorption or the retainment of water. Right? So that's what we had gotten through last class. Here. Right, we talk about glomerulonephritis. Glomerulonephritis. Okay, the glomerulus. Right. Nephritis. Oh, nephron. Okay, cool. Right, so when we think of glomerulonephritis, right, ending in ITIS, essentially anything that ends in ITS is some sort of inflammation of X, Y, or Z. So when we talk about the glomerulonephritis, right, it's generally when there is, right, irritation, inflammation of the glomerulus within the nephron. Remember the glomerulus? Right, this structure here. Remember that guy? If there's some sort of irritation, inflammation of the nephron, right, this is where we can start to have different molecules or different cells inside of the urine, which otherwise wouldn't be. Right? Remember how I'd mentioned there are these pores and fenestrations, there's these holes. There are things to regulate what can and can't get into the urine. If the glomerulus is irritated, it's inflamed, for instance, what happens is, where did my pen go? There we go. Let's just imagine the hole in the glomerulus is that big. It's nowhere near that size. Let's just imagine it's that big. Well, if a body cell is that big, it can't get through. But if all of a sudden, where the glomerulus, because it's inflamed, is now that size, now the cell can fit through. Right? Whether it's a red blood cell, white blood cell proteins, right? Now, white blood cells may already be in the urine, right? If somebody has like a bladder infection or a kidney infection, that sort of thing, an infection in the ureter, right? So white blood cells may already be in the urine, right? But as far as proteins, red blood cells, again, they aren't supposed to be in the urine, right? Because of their sheer size. But if the glomerulus is inflamed, if it's irritated, that's where they can then, right, end up in the urine. Now, next here are kidney stones, right? Literally just like you would think, right? Kidney stones. All right, it's a stone that develops inside of the kidney. All right. Literally, it's a small hard deposit, right? The vast majority of kidney stones, I think it's as high as almost 80%, are composed up of calcium, right? So if somebody has some sort of hypercalcemia, right, for whatever particular reason, one of the ways that our kidney gets rid of calcium is through the urine, or one of the ways that our body gets rid of calcium is through the urine. So if we have elevated levels of calcium, that means we have elevated levels of calcium being filtered out and passed through into the urine. The problem with that is as the calcium salts, as they begin to accumulate and coagulate, they form this hard rock. Again, generally one-sided, right? It's pretty uncommon for people to have bilateral, right, kidney stones on both sides. They are unbelievably painful, right? Because that's the thing. Imagine taking a marble and trying to squeeze it through a straw. You're like, that just doesn't really fit that well. Absolutely, right? Now imagine that marble having sharp, jagged edges, and the straw is your ureter, a pain-sensitive tissue or a pain-sensitive structure, right? So yeah, there's a reason why, right? People that have kidney stones are, they oftentimes complain of just an immense amount of pain, right? Even pain that can kind of emanate from, right, where the kidneys are, kind of feeling down towards the back, but even, kind of sometimes it kind of describes as being felt kind of into the growing of the inguinal region, and that has to do with where the ureter is and where it's located, right? You just think about where the bladder is. Well, the ureter is not very far off from the area of the groin, right? With a kidney stone, right, sometimes because of the damage to the ureter, right, you might have some kind of slight tinge of red or some slight tinge of blood in the urine itself. And as far as actual the process of urination is immensely painful, right? Because that's where the ureter is undergoing peristalsis, trying to push the urine out at the same time as trying to push the kidney stone out, and it can't move, and that's just where it can be immensely painful. All right. Next, right, we see here UTIs urinary tract infections, right? Again, very common, right? There's some sort of infection somewhere along the GI tract. There is some sort of infection somewhere along the urinary tract, right? Urethra, bladder, right? In men, obviously, we've talked about this before, how urinary tract infections are not common, right? Because of the length of the urethra, right? The urethra in the males is 4-5 times longer than it is in female. So bacteria just simply have a much, much longer route to travel, right? Much longer. Females, it's way shorter, right? It's about a level of about 1 to 4, 1 to 5, or a quarter or a fifth of the length, right? So UTIs are much more prevalent. Now, one of the things when they kind of put dementia in the elderly, that's something that is really quite common, right? As we age, right? It's kind of, when we're young, hygiene isn't that terribly high up on the list, and that's just because simply, generally, boys and girls just don't care. As we age, right, hygiene starts to lack as well, right? And it's not so much that elderly don't care to be hygienic. I'm sure there's some aspect of that. If I'm 80 years old, it's like, I don't really care if I smell like a foot. But the other part of that is because of the lack of movement. They literally lack the flexibility to perform proper hygiene. Right? But one of the more common things in elderly, right, is the development of UTIs. And a UTI is something that can definitely be kind of undiagnosed, something that can go quite a while without being recognized or noticed. One of the things that it can actually develop in the elderly is dementia. Right? It's very fascinating. It's not so much like it's not like an Alzheimer's. That's not what we're talking about. It's a completely different type of dementia. But in these kind of long-standing, bouts of a UTI, if grandpa's been fine, or grandma's been fine, all of a sudden, she just kind of started to go downhill. She just started forgetting everything. She's been super irritable, and just happened in the span of a couple of weeks. Right. One of the things that most likely, or one of the things that she may commonly have, is a UTI. For what the pathophys or what the reason is, I've looked into it. I'm not terribly sure. Right. I've read a few theories as to why it is, but why is it that undiagnosed bouts of UTIs generally develop into dementia in the elderly? I don't know. I've looked and I can't find it. Right. As far as what or why why that is. Right. But that is something that, again, it is incredibly common. So, anyways, just kind of fascinating. That's why I want to throw that out there. But anyways, that's all I have as far as the conditions of the kidney. Right? And so from here, I'm going to transition into the reproductive system. So that's where I'm going to pick up on the next video.